Hello everyone, Oscar here, and in this video I will be discussing a case study that was introduced to me in my integrated pathophysiology and pharmacology class at the University of Texas at El Paso. In our case study, Jay, a 17-year-old high school student that participates in his swim team, presents to a clinic with sudden onset of right ear pain, which worsens at night. The patient verbalizes that he feels right ear pain that intensifies when the ear is touched or manipulated. In addition, the patient verbalizes that he feels a fullness in his ear. The clinician, upon evaluating the verbalized signs and symptoms, decided to look into the situation further. Through the use of an otoscope, the clinician further assessed the right ear canal, only to find that the patient did present with swelling, redness, and yellow crusting to the lining of the canal. In addition, the patient's temperature presented at 98.7 and the tympanic membrane presented to be pearly, as well as the landmarks being intact, meaning that any signs and symptoms for acute otitis media can be ruled out, considering that the tympanic membrane is intact. Based on the patient's clinical manifestations, both objectively and subjectively, it could be presumed that this patient will be diagnosed with acute otitis externa. Considering the patient's diagnosis, the physician decides to prescribe eardrops, which will be administered by a family member. Whoa, hold on here. So you know what the reality of this is that I'm not a broadcasting major, and the truth is that, you know what, this interaction that I'm going to be having with a patient is not going to be so robotic. The reality is that, in this situation, we need to keep it real. We need to keep it real. So in the sense that with everything that presented here, the patient does present with that redness in the ear, the swelling, has that yellow crusting. It can be wax. It could be a little bit purulent drainage. We're unsure, but let's, in this case, say that it is purulent drainage in order to identify that this patient does present with acute otitis externa. So, considering the patient's diagnosis, it's essential that we develop a teaching plan for both the patient and the family in order to ensure that they are aware of the diagnosis that they received, they understand what caused that infection, and in addition to the family members knowing how to administer those eardrops. All those things are very important in order to ensure a positive outcome. So to begin our teaching plan, we need to make sure that the patient and their family are aware of their diagnosis of acute otitis externa, which is basically inflammation or infection of the ear canal or the outer visible part of the ear. They need to be able to know what they're diagnosed with. If they don't know, they're going to be like, what am I being treated for? So we need to make sure that they're aware of what they're being diagnosed with. If they don't, then what are we doing here? We need to be able to teach them that. That way they could, look into and have interest in their own diagnosis and be aware of why they're being diagnosed with this. In this case, we would make sure to explain to Jay and their family that that ear pain that that the patient is feeling is part of one of the signs and symptoms and clinical manifestations or signs of acute otitis externa. In addition to, let them know, when I looked into your ear, I did find that you did have a little bit of swelling, a little bit of redness in your ear. You had a little yellow crusting there that is probably a little bit of dry pus or infection in there. And this is why I'm diagnosing you with this, because, you have these signs and they all indicate that you have that acute otitis externa, okay? So upon identifying the diagnosis to the patient might be wondering, why did this happen to me? What caused it? What did I do? Did I do something wrong? Why am I being punished? So what we end up doing is we need to explain to them what could have caused this this situation, this diagnosis of the acute otitis externa. In this case is when we identify that, what sometimes happens is that in our ear, we have skin, right? So what happens is that sometimes there might be trauma to that skin that could have been caused by the Q-tip or, something else. Some people poke pins in their ears. In this case, possibly because he's a swimmer, probably even the chlorine might have caused irritation, which could have caused the skin to break down. Also, I don't know if he's wearing earplugs. That could have caused trauma to his ear as well. So we need to be able to identify to him that, what happens is that when there's skin trauma to the ear, our body, what it does, it sends out an inflammatory response, which basically what it tries to do is it tries to fix itself. When that happens, white blood cells, red blood cells, different cells that are in our blood that help us recover will migrate to that area, or will move to that area to try to fix itself. When that happens, think of it as a whole bunch of people walking into a room. It gets crowded. So that's what causes that inflammation. All those cells are in there trying to fix that trauma. And that's why the swelling happens. The swelling happens. It causes pain because it's just tight in there. And that's probably why he feels that fullness, because that everything that's in there causes that swelling, and then he has that fullness in his ear. So that's what's causing his pain and his swelling in his ear, is just the body trying to fix itself. Which is normal. We want that to happen. That's not a bad thing. We want that the body to want to try to fix itself. Sometimes what could happen is that when this skin barrier is broken, there's pathogens or bacteria out there that might want to get in through that hole and live inside us. I mean, they love our environment. The human body is just something beautiful to live in, and the thing is that these pathogens really want to try to get in there, and when they do, that's when infection presents. Sometimes with all these people, I can tell you, there's a whole bunch of white blood cells, working in that area trying to fix itself. In that group of white blood cells, there's cells that want to try to clean up the debris. There's other cells that want to fix the skin, and there's other ones that are kind of just keeping a lookout. Think of them as guards. If they find that one of these invaders comes in, they ring a horn and they call some of their buddies over to try to get rid of that infection. But sometimes, these buddies aren't strong enough. And that's when possibly you might consider administering antibiotics to help treat that infection if a pathogen does invade the area. Okay? So after the patient is aware of their diagnosis and what possibly could have caused this infection, our next step would be to explain to them how we're going to treat that diagnosis. In this case, there's various options. Okay, we have ear drops that could be anti-inflammatory. Anti-analgesic, basically to reduce the pain. There's also other drops that we may prescribe in order to treat the infection. And then there's other drops that are combination drops of both anti-inflammatory and antibacterial, an antibiotic, to help treat that infection as well as reduce the swelling. In the case of our patient here, we could identify that possibly a combination therapy of drops may be prescribed. Usually these combinations are prescribed in suspensions, such as this one here. I actually have an ear drop from a recent ear infection my grandmother had. So in this case, if you read, it's very hard to see, but there it states suspension. And usually these combinations, suspension drops, what you want to do is you want to mix them around and rub them. And you can also do this to warm it up. You want to warm up the eardrops, so that way it's not too cold or uncomfortable when you put it on. But to be honest with you, the main reason you want to do this is to mix the medication. You want to make sure that medication's mixed in order to ensure there's therapeutic relief and the regimen's working. Because if you don't mix it, you're not going to be getting the full effect of the medication. So, like I said, in this case, due to the fact that Jay does have that redness, the swelling, which is normal for an inflammatory response, but like I said, there's that extra little drainage there that is questionable and could possibly be the sign of the infection. Luckily, in this case, the patient does not have fever. Okay. Usually, when fever presents, it means that there's a systemic infection going on. So that means that it's all over your body. Okay. In that case, you might want to consider giving oral antibiotics, but for the reason of this case study, let's just focus on these eardrops. So, like I said, the eardrops will be prescribed. Like I said, a combination therapy might be the best treatment for this patient. So that's when we go ahead and let them know, you know what, I'm gonna be prescribing some eardrops for you. You let them know how often they're going to be administering those eardrops, and you let them know what it's for. In this case, like I said, we let them know it's anti-inflammatory. It's going to reduce your pain a little bit, and then also put a little antibiotic in there just to make sure that infection is cleared. You need to make sure to complete that regimen into as prescribed. Sometimes it's 7 to 10 days, and make sure you complete it. Sometimes it's twice a day. So if you need to administer it twice a day, you need to make sure to do it twice a day to ensure that that infection is cleared. So once you teach your patient and their family the diagnosis, the possible cause of their diagnosis, and the treatment that you will be following, in this case, the eardrop suspension will be administering, you want to teach the family member, in this case possibly the parents, how to administer this medication to the patient. So to begin, you want to tell the parents or the family members to make sure to wash their hands. We want to make sure those hands are clean, because if they're full with pathogens or bacteria, if you put contact with that ear, you run that risk of contaminating the ear and causing infection or further infection or contamination of the ear. So we want the patient to get better. We don't want them to get worse. So make sure to wash your hands to make sure you're clean. In addition to that, once you finish that, while you're washing your hands, maybe you might want to ask the patient to lay down on a bed or a sofa, with their affected ear up. That way, we could facilitate the administration of the drop and allowing gravity to help us deliver that medication into the ear canal. So usually you want to tell them to, like I said, they could even kind of like live over like this, but it's not very comfortable. So probably laying down in a bed or a sofa might be the best option. So, you wash your hands, they kind of lay down there. So next step, you have your medication bottle here. You want to start, kind of rubbing the medication. Make sure you mix it. Like I said, this is a suspension, so you want to make sure you mix the bottle to make sure the medication's mixed up as far as the antibiotic and the anti-inflammatory. While you're doing this and shaking up, you could possibly look into the ear canal, look down to make sure that there's no obstruction in the way. The patient might have maybe a hearing aid in the area, so possibly ask the patient to remove their hearing aid. Maybe he's listening to some music, has his headphones on there. Make sure to take those off. Nowadays, they even have the ones without the cords, those Bluetooth ones. So possibly those could be on there. You might not even notice. So just make sure there's no obstruction while you're mixing your bottle here. Once you make sure that there's no obstruction, what you do next is you slowly open your suspension. You remove the cap. Okay. Once you remove the cap, you look down at your patient. You make sure that, like I said, there's no obstruction. From there, in the case of Jay, our 17-year-old teenager here, what you're going to do is once you have your bottle open here, you're going to go ahead and pull the ear back and up. That way, you could open the access into the ear canal and facilitate the delivery of the medication, make it easier for that medication to drop down through the ear canal and make sure for it to be delivered well. So you pull back and up, put the amount of prescribed drops, maybe it's 2 drops a day, twice a day. Like I said, put it in there and then ask the patient to start, if you want, after you administer it. Usually what I tell my patients is kind of open and close your jaw like that. What it does, it'll kind of help deliver the medication down your ear canal and help distribute that medication evenly, okay? Once that medication is distributed evenly, makes it a good thing. You want it to be distributed evenly, so that way it could have its effect. Okay. Usually, you want to have the patient stay laying down maybe for a minute or two before standing up, because if they get stand up too quickly, maybe that medication is going to fall out, and what's the point? We want the medication to stay in there and be absorbed properly. That way we make sure that the medication does its job. So once it does all that, like I said, you go ahead and you cover your droplet here, your solution here. Make sure you apply that droplet, the cover tightly, just in case you lay it down maybe on your medicine cabinet and accidentally tilts over. The medication doesn't drop out. Okay, we want this medication. We want all the medication that's in here to make sure that we treat the infection or the inflammation properly. So take advantage of the fact that if you have a tight seal, the medication won't fall out, and we can make sure that you get all the medication that you need. Okay. After that, I mean, you could ask after your minute or two happens. In your patient or Jay feels like he doesn't have that solution in there bothering him as much, he could stand up and start walking and doing what he has to do. I would avoid having him place any objects in his ear at this point, just to make sure he doesn't have any further infections. We want to avoid any of that happening at this point, just to make sure he's treated well and there's no contamination. So once you have instructed your patient on the diagnosis, the possible causes, the treatment, and how to properly administer the medication, you would expect, the infection to be treated. During the time of infection, you need to make sure to tell the patient to keep those ears dry. So in the case of Jay, I would encourage him not to swim in the meantime, just to make sure that he does not get that area further infected, and to ensure that adequate treatment is enforced, to make sure that the medication he's being administered is being treated well. And like I said, we want that infection to be gone. We don't want it anymore. So we want to make sure to give that patient adequate time for that treatment. Usually the symptoms should start getting better within 48 to 72 hours. If for whatever reason the patient presents with worsening symptoms, or he starts developing fever in this case, I would ask the patient to come back to the clinic, just to make sure that infection is not worsening and is not becoming a systemic infection, which needs other treatments, which would be oral antibiotics. And like I said, usually the symptoms should be getting better. Our expected outcome is that this infection is going to be gone after the 7-10 days that this antibiotic is administered. After that, we could talk about the preventative treatments to this. So in the case of Jay, since he is a swimmer, I would encourage him possibly not to be swimming out in lakes, in oceans, or rivers where the water may be contaminated, and increase his risk for infection. In addition, I would tell him to avoid over cleaning that earwax, and because the thing is that earwax is a good thing. That's our body's natural way of defending itself. So a little bit of earwax is good. You don't want to over clean, and at the end of the day, these little Q-tips here, you don't want to stick them inside the ear canal for various reasons. Like I said, you could cause trauma. Sometimes that earwax, you could push it further back, which could also be a problem, because the more earwax you have built up there, the more moisture that it could create. And like I said, what happens is that bacteria loves moist environments. So you actually increase your risk for infection when you have also a lot of earwax. So like I said, don't over clean. Earwax is good. It kills bacteria when it's in there. So we want to keep earwax in the ear canal. So over cleaning is not a good thing, okay? And also another thing, in the case of Jay here, we have drops that he could administer before and after swimming that contain alcohol and acetic acid. It's a 1-to-1 ratio. Actually, these drops you could buy over the counter. If you ask your pharmacist at your local pharmacy, maybe they could direct you to it. Usually what you do is you apply those drops before and after. What the alcohol will do is not only help prevent infection, but also dry up the ear canal a little bit. And that acetic acid is the one that's going to be killing that bacteria if it does lie in there. right away it kills both gram-positive and gram-negative bacteria. So that's a good thing. It kills all sorts of bacteria in there. So that's a good preventative treatment to prevent further infections in the future. Okay, so something to consider. So once you finish, teaching about the diagnosis, the causes, the treatments, how to properly administer the medication, the expected outcomes, and preventative treatment, you want to take this opportunity to wrap up. Ask open-ended questions. Ask your patient, how will you be administering this medication? What causes do you think were the contributing factors to your ear infection? These are the questions you want to ask. Always wrap up with open-ended questions. You never want to ask yes or no questions, because that will facilitate the closure of the conversation between you and the patient. Yes and no answers make it very easily to not talk to the provider anymore. So like I said, open-ended questions are very vital to a treatment plan, to ensure that they understand what you just taught them, and to allow them to ask questions, and make sure to ask, do you have any other further questions? Because if you don't ask, you won't know, and you won't open that dialogue between you and the patient. So make sure to ask if you have any other questions in reference to your diagnosis today and your treatment, or any other question. Like I joke with my patients, always telling them, do you have any other comments, suggestions, a joke, anything at all? It doesn't matter. You always want to open that conversation between you and your patient, and that should be part of your treatment plan. Okay, so I really want to thank you all for the time you guys took to listen to my video. I hope I didn't lag as much. I know sometimes I could rag on with my conversation here, but I hope it was informative. Like I said, if you have any other comments, suggestions, a joke, make sure to leave me a comment, or whatever it is. I'm here to educate, because what do nurses do? We educate.